Mary Rose McBride is here today. She's a VP at Lifespan. Very effective VP. She tells me she got her love of writing nurtured at Nazareth Academy. And then she went to college at Bonaventure. She's been mission-driven in her career in government and nonprofits. Lifespan responsibilities, her responsibilities at Lifespan are external communications, branding, messaging, grant writing, and technology. And she is deeply involved in the large events, including the Celebration for Aging, where over the years they've engaged 16 speakers, including Julia Child, Hugh Downs, Helen Thomas, Richard Simmons, Dr. Ruth, and last July, Judy Collins, at a luncheon for 700 people. It's quite an affair. And I have some personal experience with Mary Rose. In our younger lives, we were working on a new project. At the time, it was called HelpNet. And she handled the Lifespan side, which was setting up Elder Source. Elder Source was just being formed. And I had this crazy idea of working with neighborhood centers on tying together customer records across agencies. And we put our heads together and came up with this concept. And we actually got funded to do a beta test system. And without Mary Rose, I don't think it would have ever happened. Now, in those days, I had hair. She still looks as young as she did then. I don't know what happened to me, but aside from that, I'm currently told by the people that run Pure Place, which is the current name of this network, that around 100,000 caseworkers sign on every day. So it's in many states, and she was one of the founders of it that actually made it happen, you know, and never got much recognition for that, by the way. Also, more recently, we were having trouble putting together a brochure. This is before we engaged Kathy Warner as a designer, and we were kind of at a loss. So myself and Bruce laid out a concept of a 6-panel brochure, and Lee and Sue met with Mary Rose, and she said she'd get her designer involved, and within a week or 10 days, we had a brochure in front of us. And I was wondering, how'd she get that designer to do it that fast? She did it herself. And that's what we printed, and we used for over a year. So she's a can-do kind of person, okay? So with all that, I'm just going to say, Mary Rose, the floor is yours.
Thank you, Arthur. And this man, he's right. I mean, we've known each other since 1998.
Yeah.
Yeah.
A little earlier.
Hi, everyone. Good afternoon. Hi. My name is Mary Rose McBride. I'm Vice President of Marketing and Communications at Lifespan. I have been there for 32 years. I'm sorry. I like to move around. That's my problem. I say that I'm aging in place in my chair. All right. How many of you have heard about Lifespan? Know us a little bit? Oh, wonderful, because again, that's been my job for the last 32 years. Do we have our PowerPoint up? Oh, sorry. Yeah. There you go. Thank you. So Lifespan is a nonprofit. We're a regional nonprofit, actually. We were founded back in 1971 by a group of nursing home administrators who believed that older adults should be able to get services in their home rather than moving right from their home into a nursing home, which back in the 50s and 60s was your option. There weren't all these higher, different levels of care in the community back then. So they went to United Way and they started an agency known at the time as the Regional Council on Aging, which was a funny name because at the time we weren't regional, it wasn't a council. So I don't know where they came up with it. But now we are regional. We have 30 plus different services. All of them are available in Monroe County, and many of them are available in outlying counties now. We say that we're a resource for people who need help with the challenges as well as the opportunities of longer life. Our services are, everyone always asks, how are you paid? Mostly our funding comes from the federal government, through the state government, to the local government. We do a lot of foundation grants. We do our one big fundraiser a year, as Art mentioned. And Art, I have to correct you, last year we had, or in March, we had 1,300 people at the convention center for Judy Collins. We have United Way funding, and we get our private donations, but most of our services are donation based. I will tell you when one of our services isn't. So Art mentioned Elder Source, which is a service we started way back in 1995 in collaboration with Catholic Family Center. At the time, we were a very small agency. When I got there, we had 25 staff. Now we have 200. We didn't have a service for people who were just calling to say, I need services in my home and I don't know what's available. Or my mom fell and she's in the hospital and they want to send her home and I don't know what to do. Or my dad lives in the city in a 2-story house and the bathroom's upstairs and I don't know what to do. So we started this care management service with actually original funding from RG&E to do sort of just general care management services using social workers. So we said, we'll go out to a house, we'll meet with the older adult, we'll meet with family members, we'll do an assessment of what is going on, what's needed, an assessment of what's known as activities of daily living or instrumental activities of daily living. Can you get up from a chair? Can you cook your own meals? Can you provide your own personal care? And then we come back with a care plan for what recommendations we think services could be brought in, or maybe it's a person really does need to look at moving to a higher level of care. Now, this afternoon, actually, we're doing a housing options workshop because it's so complicated knowing all these different levels of care out in the community, how much they cost, what you get, how long you can stay there if you run out of money. So our workshop this afternoon is completely sold out and we have people walking in the door just to say, I hope I can get in. So Elder Source is our general care management service. Then about almost 9 years ago now, we won funding from New York State to provide specialized care management for families caring for someone with Alzheimer's or dementia, because that becomes a longer journey for people. This is my mom and I. My mom had Alzheimer's for about 15 years. What? I'm sorry. Okay. My mom had Alzheimer's for 15 years, and I know what the journey is like. I know that every time you get services in place and you think everything's fine, and then that person does a little downward spiral and you need something else in the family, in the environment. So our Finger Lakes Caregiver Institute provides services, care management for families dealing with somebody with dementia. We do a lot of caregiver education. We have a workshop called Powerful Tools for Caregivers, which really is about helping caregivers learn how to take care of themselves while caring for someone else. And we're trying to increase the availability of respite for caregivers, because if you're caring for somebody 24/7, sometimes you just need that break to get out of the house, to take a shower, to go to Wegmans, have lunch with a friend. So we're trying to recruit volunteers to provide respite for maybe just a couple hours a week for a caregiver. Then, because the caregiving journey can be so long with Alzheimer's, we discovered that people need some help afterwards. Like, they've become the caregiver and they don't know what their role is after that. So we started Grief After Caregiving. It's an online support group right now, happens once a month, for people who are in that situation and just want to talk with other people who have been through that journey and, you know, looking to come out the other side of it. Like, what do I do now? Then for many years, basically our whole history until very recently, it's funny because community-based services like Lifespan have always sat outside of the medical systems of care. We could have clients who have doctors who were in the hospital, who were in the ED, and we would never know about it. And the doctors in return and the nurses didn't know we were involved in someone's care out in the community. So we went after another contract from New York State in 2015, and we did a small pilot working with a few medical practices. And we said, refer us your patients who you think need additional help in their home or out in the community. Maybe they're missing appointments. Maybe they're having trouble scheduling specialist visits. Maybe they're coming and you're not sure they're taking the right medications. So we started Community Care Connections, where we're working with over 100 physician practices now, only getting referrals from those practices when they have patients who meet criteria of needing help with medical care and help on the social side. Because doctors and nurses don't see what's going on in the home. And what goes on in the home is a huge factor in somebody's health and medical care. So we go to the appointment. We hired LPN nurses who go to medical appointments with older adults. They're the scribe at the appointment. They're the person who remembers to ask the 5 questions that you wanted to ask your doctor, but you know how when you go, you forget 2 of those questions. We're there, and then we go home and we do the med reconciliation, make sure the medications are correct, and then we'll help the person make follow-up visits and or arrange for transportation to future appointments. This service is being evaluated by an entity in New York called the New York Academy of Medicine. And we've proven that when we work with the medical systems on the social side and the healthcare side, we can reduce unnecessary ED visits and hospitalizations by 25 to 30%, which is huge because none of us should be in the hospital if it's unnecessary. And today, hopefully none of you have to end up in an ED soon because the EDs are overrun right now. The hospitals are overrun because they can't get patients out into nursing homes because the nursing homes don't have enough staff to open all the beds. So everything is kind of a mess right now. So with this service, our goal is to keep people out of the hospital unnecessarily, out of the ED, out of observation visits, and really help coordinate that care between the doctor's office and our services. It's being replicated right now in several areas across New York State because we're saving healthcare dollars and making care better for people. Now, sometimes, although we offer these care management services and can provide information and guidance for families, sometimes families don't agree. And we were noticing that sometimes there's the adult daughter here, but siblings are living someplace else. The adult daughter could see what's going on, but the siblings living someplace else disagree. So we started a family mediation service. So one of our staff became trained as a mediator, and this is all about helping families, you know, when the siblings are now grown adults, but they still have those sibling rivalries from when they were teenagers or whatever. This helps families learn to make decisions together. And these are hard decisions sometimes. dealing with parents or dealing with grandparents or dealing with aunts and uncles, or even other siblings, you know, what's needed, what's available. Sometimes it's a disagreement about how much money to spend on bringing out care into the home, or about placing somebody in independent living or a nursing home. So we started this in hopes of helping family disagreements. Then this is a service we wish we didn't have to provide. When I started at Lifespan in 1992, we had 1.5 social workers working in our elder abuse prevention program. Today we have 25 just in this one service. We got involved. This is a regional service, and in fact, we run a statewide coalition about elder abuse. We get involved in cases of physical abuse, emotional abuse, neglect. The only time we don't get involved is in self-neglect cases, where an older adult really is a hoarder or self-neglecting their care. Those go to Adult Protective Services at the county. But the most common form of elder abuse is financial exploitation by people who know the older adult. It's the most common form. We have clients who have been scammed out of thousands of dollars by their adult children, by grandchildren, by caregivers, by friends who get a hold of the ATM card, the bank accounts, threaten an older adult. It's the number one issue we get involved with. Every year, about 400 cases of elder abuse come through our doors. We try to do a lot of education because the topic of elder abuse, even today, is much like the topic of child abuse was back in the 50s, 60s, 40s. No one acknowledged it, and really nobody talked about it, and nobody reported it. Still, New York State is the only state in the country that does not have mandated reporting of elder abuse. So if an older adult ends up in the ED with bruises or whatever, there is no mandate for that healthcare worker to report that to anyone. Now, hopefully they do, because we've been trying to educate people, but there is no mandate right now. Again, it's a service we wish we didn't have to provide. So along with elder abuse comes just sort of the normal scams. We did a video for our event in March at the convention center, and we had 2 victims of scams who did the video for us. One lost $90,000 and the other one lost $50,000. The woman who lost $90,000 has 2 PhDs. She worked for the Sierra Club out at Yosemite for decades, retired, got a new computer. Somebody got into her computer somehow. She got the, virus warning alert. We need to get into your computer. They did. And they basically, as she said in the video, took over her life. The other instance was a couple. The wife was falling into dementia, and she was believing that an old high school flame was reaching out to her and that he needed money, and she was giving him access to money, and the husband didn't realize it until too late. So these things happen. When my mom was in the middle of Alzheimer's, she believed that there was $1 million waiting for her at the Niagara Falls border, right? And all we had to do was take her there. My father had to get her on the phone with the Attorney General's office to try to make her believe that it didn't happen.
What was the scam with the Sierra Club woman? What was that about?
That was a computer scam where they got into her computer and took over her computer and got into her bank records and her credit cards and everything.
You're protected by law, federal law.
She lost $90,000, and there's something called the New York State Victims Fund, and you get back a pittance of that. The other scam that's happening right now is the romance scam, where an older adult is scammed by a person who's pretending to be somebody they're not. And this person supposedly falls in love, and the person really wants to come here and see you, but I don't have any money to do that, and on and on and on it goes. And then there's the grandparent scam, where you think you're getting a call from a grandchild, but it's not. The grandchild's been arrested. Oh my God, don't tell mom and dad. I don't want them to know, but I need bail money. Nope, that's a scam. We have an array of financial services at Lifespan. I'm sorry, I'm probably going back and forth and driving you all crazy. The first one is our financial management service, where we train volunteers and bond them to provide in-home bill paying, budgeting, and benefits assistance for older adults. This service is like perfect for somebody who's maybe got some early dementia or macular degeneration and can't see to actually write out the checks anymore. Somebody whose spouse took care of all of the finances, somebody who has been scammed, we might get involved. Well, we'll go in just once or twice a month and make sure all of the bills are being paid, the finances are being taken care of, and there aren't the full shoe boxes worth of stuff everywhere. The next level up from that is what we call our financial care management service, where Lifespan can become limited power of attorney for somebody. And basically, we take over their finances. Again, perfect for somebody who has fallen into dementia, perfect for victims of elder abuse, where there's been financial exploitation by a family member. We notify all the creditors, all the bills start coming to us. We make sure they get paid every month. This is one service that is not donation-based. This is a fee-based service because there's no government contract that pays for this. So it's based on someone's income and resources. But it's really a valuable program if somebody just can't handle their finances anymore. Sort of along that lines, we provide expert information and guidance about Medicare. So, you see these commercials on TV about the Medicare brokers, they're advertising their services, they'll help you sign up for Medicare. They're being paid by the insurance companies to do that. We have a contract from New York State to provide non-biased, nothing to sell information about Medicare. So every month on our website, you'll see 3 or 4 different workshops about Medicare. During open enrollment, we do extra workshops about Medicare. We do one-on-one appointments, either via phone or in person, about Medicare and your Medicare choices. Now, during open enrollment, we serve thousands of people, but it's always a good idea to check your coverage as if anything has changed with your prescription plans or prescription drugs, whatever you're taking. It's a good idea to review that every single year. We have about, 3 staff and about 15 volunteers who are trained in Medicare and providing guidance who do this service. Future Care Planning is a service we started back in the early 2000s, specifically for people who were caring for somebody with a developmental intellectual disability. Now we've expanded it to families caring for somebody with any disability. And originally it was because people with developmental disabilities are living longer like the rest of us. And for the first time in history, they were outliving their main caregivers, who were usually their parents. And one of our staff went to the funeral of a client, and the daughters came up to her after the funeral and said, "Please don't leave. We don't know what's going to happen to our brother who had a developmental disability now that our mom has died. We never talked about it." So we started Future Care Planning Service. It's in collaboration with the El Segal Community of Agencies and the Arc of Monroe to help families take that planning step, to help plan for the health, the housing, the legal, the financial future of a person with a disability, so that the crisis doesn't happen. The Ombudsman Program. This service, we provide in 9 different counties. We rely a lot on volunteers who are trained to do this. We are advocates for people living in nursing homes and licensed facilities. Now, before COVID, we had like 80 or 90 volunteers in this service. After COVID, we've got about 35. Obviously, the volunteers couldn't work during COVID. We couldn't get into the nursing homes. We lost a lot of our volunteers, but they are trained to be advocates for people living in nursing homes. So anything as tiny as, you know, we keep sending down the laundry, but mom's laundry is not coming back to her. One time I did a presentation and a woman came up to me and she said, my mom is lactose intolerant and they keep giving her regular milk. How do I stop this? All the way up to we help when the Department of Health comes in and starts to close down a nursing home because the care was so bad. So we have ombudsmen on staff. We train ombudsmen to go do this. They go into nursing homes, spend a few hours a week there, get to know the residents, try to get to know the staff, and try to be that advocate and mediate any problems. Now, wellness and recovery for older adults. Until recently, this was called GAP, the Geriatric Addictions Program, but it's for people 55 and older. And all of a sudden last year, it dawned on us that somebody 55 doesn't consider themselves geriatric. So we changed the name to Wellness and Recovery for Older Adults. This is another service we started way back in early 2000s because we were seeing older adults cycle in and out of EDs with drug, alcohol, and prescription drug addictions. And they were just going to an ED and the ED was sending them right back and nothing was getting solved. So we went up to Toronto and we found a service up there that we liked. We copied it, we brought it back here. And now we're doing, for the last 25 years, in-home counseling and care management for older adults who are abusing, misusing drugs, alcohol, prescription drugs. This service is perfect for older adults. I have a friend, my friend Jean, who's in her early 80s. Her husband died a couple of years ago. She was always a heavy social drinker. Jean loved her Manhattans and martinis. But after her husband died, she became much more than a social drinker, and she wasn't a happy person doing it either. So this particular service was perfect for someone like Jean, who we try to get them to recognize the harm that their addiction is causing both to themselves and to their family members, and then hopefully move them into an abstinence program. Oh, I did that one twice. Okay, falls. How many of you here have ever fallen? Okay. So what happens when you fall? You become more fearful of falling, right? ED, yes, that too. And then you're more fearful of falling. So you start limiting your activities. Well, it's been proven that once you start limiting your activity levels following a fall, you're actually more likely to fall again. So this service, our Matter of Balance program, do I have this? We do. Matter of Balance is an evidence-based workshop we do that helps older adults get over the fear of falling and helps you increase your activity levels so that you don't fall again. And then we brought Tai Chi into the community a couple of years ago. 16 weeks of Tai Chi, we do it for $20 total. 16 weeks of Tai Chi. Yeah, look at our website because we're everywhere. People love Tai Chi. It's all about balance. It's all about movement. You can do it in a chair. You can do it standing up. But it's a wonderful workshop for people who have fallen or are fearful of falling. Along those lines, we have a van that is called Home Safe Home. And we go around and install safety equipment for minor home modifications in the home. So we'll come in and we'll put in grab bars. We'll put in a railing from the garage to the kitchen, put in a railing up the stairs up to the second floor, put in raised toilet seats, grab bars, all minor home modifications that prevent falls. We do about 1,000 homes a year in this service, and we don't advertise it because we can't keep up with the need. We got a lot of referrals from OT, PT people, and then word of mouth. Completely a donation-based service, and people love it because they can grab that hand bar and it's like something concrete. We have another workshop called Living Healthy and Living Healthy with Diabetes. They're two different workshops, but they're all about helping people live longer and better with a chronic illness, because we're all living longer, but many of us are living longer with chronic illnesses. So whether that's arthritis or COPD or diabetes, these two are another evidence-based workshops that help people just learn to live better, learn how to eat better, learn how to communicate with your doctor, learn how to communicate better with family members. And then transportation access. What happened back in the 1960s and 70s? We all moved out to the suburbs and we were all very car dependent. And now 80% of Monroe County's older adults live in suburban areas rather than the city. And what happens when people don't want to drive anymore? So transportation is one of the #1 reasons people actually call us. We have mobility specialists on the phone that you can call. They know what all of the transportation options are in the community. They can get you in touch with them. And we just started a new website, it's not on here yet, called heretoThere.help. And it's a point-to-point website where you can put in, I live in Arundecoit and I need to get to Strong Hospital. What are my options? I need wheelchair transportation. I need door-to-door. I need some assistance. I just need a car. It'll tell you what all your options are. Free or fee. heretoThere.help. We just launched that about a month ago. And then we have a couple of several older adult centers. We don't usually use the word senior center at Lifespan. We call them cafes or resource centers. We have one at the Maplewood YMCA called the Lily Cafe. It's been there for 12 years. It's just a wonderful place where people of all incomes and racial diversity come together for food, family, and fun. And then we have had for years our downtown older adult center. It's located in Sibley Square, the old Sibley building, downtown. Again, food, friend, and fun. And we are located at the JCC. We have staff there now for a gathering spot at the JCC. And at St. Bernard's Apartments down on Lake Avenue, we have staff. I talked about this a little bit, but this is a pitch for volunteers. Our Partners in Caring volunteer program, which really is trying to increase the availability of respite options for older adults. And we recruit drivers to provide free rides for medical appointments. We recruit, we do the background check, we train people, and then we give those volunteers to about 15, there's about 15 small little transportation consortiums throughout the county that are geographically or sometimes congregationally based. And we give those volunteers to them so that we can provide rides for older adults. And we have the AmeriCorps Senior Program, which is just, it's a national program that helps older adults who want to volunteer and don't know what they want to do, really find a fulfilling volunteer opportunity. So it could be we work with another nonprofit agency in Monroe County or Livingston County, or it could be one of our volunteer opportunities. And then finally, we have our gerontology certificate program. It's an online course that's taken by about 100 people a year. It's 32 classes, Wednesdays from 4 to 6:30. It's taken by professionals and social workers, but it's also taken by older adults who just want to learn more about the aging process and all of the issues that come with it. And all of our educational workshops are online on our website. Check it out every single month. During this particular month, we have what we call Information and Inspiration. It's a set of 20 free workshops. The housing workshop is this afternoon. That's sold out. We're doing legal aspects of aging on Thursday. That's sold out. We're doing pitfalls with legal elder care planning on next Tuesday. That one is sold out. But we also have the myths and realities of hospice and palliative care. There's still room in that one. We have medical marijuana basics for patients and families. That one's still available. And we have funeral planning on Tuesday, May 21st. That one's still available, along with a volunteer fair we're doing on May 30th, an older adult employment fair we're doing on May 31st, and of course, the day of hearing on May 16th. Okay, I think that is, oh, sorry. Just to let you know that the HEAP program, Home Energy Assistance Program for people 60 and older, it's the county's program, but it's located at Lifespan. And we have phone counselors available to you 8:30 to 4:30 every day of, well, Monday through Friday. They sit on the phones, they provide information, guidance for people. You don't have to know what service you need at Lifespan or any place else. You just call them. They will listen to what you need. They might do an intake to one of our services or even to another service like Meals on Wheels. This goes back to what Art and I did 40 years ago. I don't even know. But that's just call that one number, 244-8400, and you get to whoever you need. Okay, thank you. Questions, concerns? Yes, I will try to repeat the questions. Can I walk around?
I was the ombudsman for 18 years. And in one of my nursing homes, I walked in and I found one of the nurses sitting in the corner, open than a stone. I went to the head administrator. I told her. She told me, "What difference does it make? They're all going to die anyhow." Well, I called the social department, aging, and the police. And this is how important you watch your loved one in the nursing home. The ombudsmen are very important.
Thank you. Did everyone catch that?
Couldn't caption it.
I'm sorry. Kate?
Yeah.
Kate was one of our ombudsmen for 18 years. And she walked into a nursing home one day and saw that okay. She walked into a nursing home one day and saw that one of the nurses was drunk. And they said to her, you know, she complained and she said, you know, this is not good care. And someone said to her, what does it matter? They're all going to die anyways. So she's just saying how important the ombudsman program is and the volunteers that we have.
Could you elaborate more on the volunteer program and the employment program on May 30th and May 31st?
He's asking about our volunteer fair and the employment fair. The volunteer fair is Thursday, May 30th. I have some of these flyers for you too. Thursday, May 30th, 9 to 4 at Lifespan. You'll come in and you'll meet with, it'll be just a fair where you go table to table and learn about the different volunteer opportunities we have at Lifespan. And then for the first time, we're partnering with Rochester Works to host the Older Adult Job Fair and Employment Workshop. It's Friday, May 31st, 10 to 2 at Lifespan. There's going to be 2 workshops, one in the morning and one in the afternoon about, I'm sorry.
We'll be there.
Oh.
We'll be hiring.
Okay. Good. There's going to be 2 workshops about how to find a job as an older worker because there still is ageism out there. And that was it, I think. But I have more of these. I have more of these flyers if anyone's
How
interested.
many people attend these?
Pardon me?
How many people attend these fairs?
Well, we've never done the older worker fair before. We don't know. We've done a volunteer fair before. We've had about 50 people walk in the door, you know. Yes.
Are these services limited to people who live in Monroe County?
So again, all of our services are available in Monroe County. Some of our services are available, like the Alzheimer's Care Management Service, elder abuse prevention, the high cap service, the ombudsman service are available in outlying counties. But it depends what county,
So Orleans included?
not usually. It's more towards, Orleans kind of tends more towards the Buffalo service area for some reason. Yeah. Yes. Time, questions?
Your giveaways back here.
Oh, my giveaways. I do have some giveaways. Sorry, I couldn't see it. I do have some they're little hand sanitizer giveaways you can attach to your purse or your bean. How am I doing, Eric?
You're in fine,
Okay.
15 minutes.
Oh, wow. Okay, I sailed. Any other questions?
Yeah, can you tell us, you said the heat program is located inside your organization?
The HEAT program, the Home Energy Assistance Program for people 60 and older. It's the county's program, but it lives at Lifespan. Mhm.
How are you doing on getting volunteers?
How are we doing on getting volunteers? That's one of the focuses of my last 2 years of my life, Art. We're doing better. But we usually have about 300, 350 volunteers. And again, COVID kind of shrank those numbers. So we're trying to reinvigorate our volunteer programs. Our volunteers are so important to our programs. They're financial managers, they're the ombudsman, they're drivers, they're high cap Medicare advisors. I mean, they're very, very fulfilling roles. And, all we can do is ask, which we try to do a lot.
I know this might be a little far afield, but since dental work is not covered by Medicare, is there any kind of dental program or dental anything on the horizon for people over 60?
Not that I know of. He's asking about dental services for people 65 and older, since Medicare doesn't really cover. Some Medicare Advantage plans, I believe, have some dental coverage. Traditional Medicare does not still, but you'd have to call our high cap program to ask more about that.
My wife is a volunteer elderberry driver, and she was very happy to learn that the insurance company says, watch it, trying to help these people physically.
Yeah.
Because of the insurance liability.
Right.
And she's older herself, so she was glad to be short of that.
Yeah, he was saying his wife is a driver for the Elderberry Express, as if she is a volunteer driver, and the insurance company does ask some questions about it, but yeah, you have to be careful. Yes.
I am delighted about the cooperation between Lifespan and HLAA. This is really a win-win situation both ways around. I came here from another county where nothing like Lifespan exists. And this was years ago. A Lifespan staffer presented at one of our meetings, and at that time, I thought, oh yeah, what is it? And okay, time has gone on, and I am now acquainted with and used some of Lifespan services. We are lucky they are here.
Thank you. She's saying, and we love the partnership also with HLLA. You guys are in our building every single month, except in the summer. No. But it is a great partnership, and Lifespan is unique. There aren't many places. Every county or region in the country has what's known as the Office for the Aging or the Regional Office for the Aging. But they, throughout the country, do not provide nearly the breadth or depth of services that we do here at Lifespan. We get calls all the time from people saying, you know, my parents live in Florida or they live in Virginia or whatever. Do you have a Lifespan there? And I have to go, no, there is no such thing as another Lifespan. There are services out of the county offices for the aging. But again, they're not nearly as, I'll say, innovative as we have been over the years to bring all of the 30+ services we do under one roof.
The question was raised about the cooperation with Lifespan. And I just wanted to point out that every year we actively participate in your fair on falling. And because of the strong connection between hearing loss and balance issues. And of course, hearing aids won't solve balance issues, but sharpening all of your remaining senses will. And that's something that we've been given an opportunity to communicate with people.
Yes, yeah, I don't know who. Yes.
Mary's been trying to.
Oh, I'm sorry, who? Mary?
Mary.
Oh,
I'm wondering if you have any connections with the Veterans Administration, especially for doing, you know, home safety evals, because they do that.
she's asking if we have any connection with the VA. We're trying. It's a very unique system. The one connection we know we do is that we're trying to work better on a referral relationship back and forth. So when they meet people, older adults who are vets, that they know what we can do and we know what they can do. So the beginning of that kind of relationship right now.
I can give you a name.
Oh, good. She's going to give me a name.
In my Syracuse house, there's a service of some sort that for seniors, where if you need a handyman, they have a retired handyman who will come and do work at your house. Do we have anything like that?
I wish.
I do too.
He's asking about if we have a handyman service kind of thing, or even, you know, I get questions all the time. Can you recommend a handyman? Can you do this? Can you do that? And our lawyers won't let us. You know, I would love to come up with a list of recommended handy people who can do things for people, but it's just so fraught with lawsuits and things.
Catholic Charities has that program.
Yes, they still do.
I mean,
Okay.
it's-
Catholic Charities, Catholic Family Center does have a small program that does do that. Oh, good. And it's free. Okay, cool. Oh, yes, I'm sorry.
I just want to say that the breadth of services that you do provide is absolutely amazing.
Yeah, people don't
Everything that you described, I mean, it's not, some of the services that you described are not things that perhaps this group is necessarily going to use right now, but the breadth of services and everything that you do is just amazing. And in other communities, I don't think that they have that available to them. And it is just amazing how up to date and everything that you are doing. You just need to be applauded for that. I am amazed at what you're doing, and you must, I'm sitting in my head adding up all of the social workers and volunteers and other workers you have working there. It must be a huge staff.
Oh, 200. We have 200 on our staff. She's saying, thank you. How amazing. You know, we've had two very visionary leaders in our lives at Lifespan. Fran Weisberg, who was one of our leaders for 10 years from 1994 to 2004. And then Anne-Marie Cook now, who's been leading us since 2004. They're both visionaries, and they both, if they see a need or a gap in service, they're like, all right, we're going to do something about it. We're going to apply for money. We're going to find money. We're going to find something to fix this. So yeah, thank you. Somebody way back. No? Thought I saw a hand.
Regarding elder abuse program, is this something that can be started anonymously by a non-family member who knows about a situation that the family isn't doing anything about?
Can an elder abuse situation be reported anonymously? Yes, it can be reported anonymously. Ultimately, if an older adult has capacity and is aware of the situation that they're being taken advantage of in one way or another, unless they let us into that situation, we can't force our way in, obviously. If the older adult doesn't have capacity, we would work with the courts or the older adult protective services at the county to try to make a change. But ultimately, older adult, has to say, yes, I want help, or yes, I want help with this situation. Good question, though.
Okay,
Is that a question way back?
way back.
I have a question on your on-bed program. I know you said you, there was a lot of volunteers that didn't come back after COVID. And I myself, this is very personal to me because I have a mother at St. John's Home, been there since 2019. So I went through the lockout, when we were locked out for over a year. But it's so, I see it every day, it's really sad because people going in as private pay at St. John's. Some places like Monroe County Home will take Medicaid patients right in the door. But once they go through the resources at St. John's, then they won't kick them out. But the thing is, they don't have the help they need. These people who have worked all their lives, most of them, American citizens, they're just not getting the care that they really deserve. And it's so sad. And I don't know why this keeps going on and on and on. I know Charlie Runyon, who had St. John's, says that they're losing about $300 a day on a Medicare patient once they go on Medicare. And the Medicaid reimbursement has been cut tremendously for a lot of us throughout the whole state. And I just wish something could be a little bit addressed. This issue could be addressed.
Yes, the whole long-term care system in our country needs to be addressed. It's number one, not prepared for the aging of the population. Number two, when you're paying $500 a day to live in a nursing home and not getting the right care, that's a travesty. If you have to go into a nursing home on Medicaid, your choices are usually extremely limited. It's much better to have some ability to private pay for a year or two in order to get into one of the better homes. But we lost 1,000 nursing home beds in this region, which is about a 9-county region since COVID, because they just don't have the staff to open the beds. Which is causing, again, the backup in the hospitals and the EDs. So the whole system is not working right now. I don't know what the answer is. One more question.
Mary Rose, there was a study that was done at Johns Hopkins, and it was published in the last couple of years. It's an otolaryngologist and an audiologist, a 10-year study. They found 40% higher to take care, more expensive to take care of people with hearing loss. More than 40% more likely they will use the emergency department as their health care. And thirdly, more likely by more than 40% to be readmitted to the hospital within 30 days after admission. And I see that connection with something that you're doing, and I'm wondering if you should be keeping track of that, because statistically, it could be very important, particularly for any monetary grant that might be helpful to us.
Wow, yeah, that is excellent. If you have the link to that research,
I do.
we would love to see it.
It
I'll
does.
give you my card.
Okay.
Yes. All right.
That's echoed by a recent study in the UK, where they said it was about 50% more likely to be in the emergency.
That's not good.
It said more than 40, about 48%.
All right. Thank you so much for your attention. I really appreciate it. If you have any questions, I have some of our brochures back with me. I have the workshops that's going on. I have the day of hearing brochure flyer, unless you don't have it. Oh, it's on the chairs. And I want to thank you for your attention. Thank you.
Thank you so much. As you can see, Lifespan is a gem in our community.
Yeah.
I think one of the problems they've got now is to make the community know everything they do. I mean, it's amazing what they do.
We don't have the money.
Right? You got the same problem we got. Anyhow, working with them on the demo center and all the arrangements, they give us the space every month. All the arrangements for stuff and for the testing and so on and so forth. Anytime we need something from Lifespan, it's a joy to work with them. They're extremely responsive, extremely helpful. You should just understand that. And you see what happens with can-do type people. You got Anne Marie Cook, the president, Mary Rose, Paul Kakamies, who's a great friend of HLAA and has been most helpful. And then this whole staff of people doing this stuff. Now, personally, I got to share with you that within the last 2 months, I used that safe home.
Safe home.
Yeah, safe home. Yeah, because a neighbor had fallen and broke her leg and she was coming home to a 2-story house. And so this fella, Ken, came over to the house. He called me up. He said, I want to come over and I want to go through the house with you before she comes home. So he did that. And then he said, okay, now let me know when she's coming home. So I let him know exactly when she was coming home, or like 2 days before. He came over with another guy and they put up these grab bars all over this house and did all kinds of things in that house. But he wanted her there to measure the heights for every grab bar. And those things are a godsend. And what a professional job. So then I said, well, how much do I owe you for all this stuff? He said, you don't owe us anything. It's part of a grant. It's amazing what they're doing out in the community. So thank you very much.
Thank you.
And I hope that Lifespan will continue to be as vibrant as they've been in the past.
At least until I retire, Art.
You're never going to retire, Mary Rose. You're one of those people, you can't retire, because if you ever retire, what are you going to do, you know? Become a volunteer?
Retire is hyphenated. Yeah.
Hey, if you ever retire, come home and talk to us. We can put you to work. Okay, let's see. We're just about here. Got a couple of minutes. Remember to fill out the evaluation forms, please. And again, thanks to Mary Rose. And next month, we're going to have a presentation by Catherine Clark, an audiologist who goes to Ethiopia every year. And we help support her doing that. And she's going to speak on supporting hearing loss in Ethiopia. So she has a little depth and background in that.
Fred wants to say hello. Oh, Fred. Fred, hello, Fred.
Okay, I'd like to ask you to do a favor for me. You had Bert Foos' daughter there today, and I've been trying to contact them to find out where Bert was finally laid to rest, but I have been unsuccessful of receiving an answer from him. And I would also like to receive a copy of those things from the national account. If Nancy Myers is in the audience there, ask her to take one. She comes and sees me. Her and her husband have been great, and I appreciate all the cards and letters I get from
Yeah,
from all you people. It's so much appreciated. Thank you so much, all of you.
And Fred,
But I would appreciate that information on where Bird is, Art,
We'll
Ted, if you
get
can
that
get
to
that
you.
for me.
we'll get that to you.
Okay, thank you.
Okay. And have a happy birthday when it comes around.
That's next month. Okay.
Okay, so that's it. Anything else? I think we're about done here. Remember, seniors helping seniors is over here. Pick up some information, take it with you. You never know when you might need it. Yes, Barb?
Did you give the date of the Stellar Supporters meeting? I think it's tomorrow night.
Yes, it
I
is.
heard you say Stellar Supporters, I didn't.
Stellar Supporters is tomorrow night,
Tomorrow night.
7 to 8:30 on Zoom. Okay,
Just to add to that, the Zoom link will be sent out around 8 o'clock tomorrow morning.
okay. I think that does it for today. Thank you all for coming and for your attention, and take care. Have a good month. Enjoy the school.